Hello, my name is Sarah, and I have
Graham.
here with me today, and here we're going to talk to you today about the heart. And I work at the National University of Ireland, Galway, at a research centre called CÚRAM, and we develop medical devices. Now, if you have any questions after our talk today, you can ask your parents to email me at sarah.gundy@nuigalway.ie. And I can also send on any questions to any of the scientists that we have. So if you want to know what it's like to be a scientist, anything at all, like what they do in the lab, or even what kind of food they like to eat the best, feel free to send on any questions you have to me at that email address. Okay, so Graham is going to help me today to talk to you about the heart. And if you like, you can continue watching this talk, and we'll teach you how to be a biomedical engineer to use biomaterials to fix a broken heart. Okay, so the first part is a talk, and then if you want to, you can watch the second part and do a little activity with us, but that's totally up to you. So the heart is a muscle in the middle of your chest, and it pumps blood full of oxygen and nutrients all around the body. Yeah? So, in your body, there are blood vessels in your body that are called arteries and veins, and they connect your heart to all of the parts of your body. Each time your heart beats, it pumps blood through your blood vessels to all of the parts of your body. So, in your body, the first type of blood vessel, called a vein, these veins carry the blood without oxygen to the heart. And on the left-hand side of the screen, they're shown by the blue lines that are all over the body. And the second type of blood vessel that you have, the arteries, carry blood with oxygen away from your heart. So a really simple way to remember this is that arteries begin with the letter A, and so does the word A. So just remember, arteries carry blood away from the heart. Yeah, that's a little trick. So some fun heart facts for you. Your heart beats 100,000 times in one day. It beats 35 million times in a year, and it beats 2.5 billion times during your average lifetime. So now I have a little question for you, okay? And you can guess as well at home with us. So imagine you left your tap running, okay? How many years would you have to leave that tap running to equal the amount of blood that your heart pumps during an average lifetime? How many years do you think you'd have to leave it running? I'll give you a little guess, Graham.
What?
It's a little longer than my age.
64?
No, not 64. No. Do I look like I'm in my 60s? No, sorry. Thanks a lot. How about a little lower? Guess a little lower.
52?
A little lower.
45?
A little higher.
46?
Yes, 46 years. So you would have to leave the kitchen tap running for 46 years in order to equal the amount of blood your heart pumps during an average lifetime. So that is a very long time to leave your kitchen tap running. Please do not try this at home. Promise me. So we're going to talk to you a little bit about your pulse. Your pulse is what you feel in one of your arteries as blood stops and starts as it moves through those arteries. And we usually take your pulse in what's called a beat per minute. It's the number of beats your heart pumps per minute. And in general, that's going to be 90 to 120 beats per minute if you're a kid. and as you get older, it's going to average at 72 beats per minute when you're an adult. But in general, the more fit you are, the lower this heart rate is going to be, the lower number of beats that you will have per minute. And that's because your heart is stronger and is able to pump more blood more efficiently around the body, and it doesn't have to pump as many times per minute. So famous athletes you might know. Graham, do you know of any?
Lionel Messi, Cristiano Ronaldo, and Usain Bolt.
Yes. So any famous footballers, any famous sprinters, can you guess how low their heart rate would be per minute?
50 to 60.
Yeah, they could be 50 to 60 beats per minute. Some of them may even be in the 40s. You don't want to go too low though, otherwise you may start to feel dizzy. So if you know of any famous athletes that you know of, maybe you can email them to me, because I don't know very many of them here. So feel free to email me some names of famous athletes to use in my next presentation. So we're going to learn how to take our pulse. Okay, so if you look at our picture here, you can see this person in the picture is using 2 fingers and placing them right underneath the thumb at the wrist. Okay, and so we're going to take our 2 fingers and we're going to do the same thing and place them right at our wrist underneath the thumb. And Graham, why do you think we use our 2 fingers?
Because there's a tiny pulse in your thumb, and you might get confused between that pulse and the one in your wrist.
That's exactly right, yes. So that's why you always use your 2 fingers. So have you found your pulse yet? Because we're going to take our pulse for 6 seconds, and then we're going to multiply that by 10 in order to find our beats per minute. So Graham, have you found your pulse?
Yeah.
Okay, so get ready to count in 3, 2, 1, and count. Stop. Okay, so do you have your number?
Mm-hmm.
Can you tell me your number?
8.
8.
Mm-hmm.
Okay, so if you multiply 8 by 10,
It's 80.
80. Yes, so Graham, you have a heart rate of 80 beats per minute. So I would qualify you as being very fit. Yes? So I hope you found your heartbeats. You can email me what your heart rate is if you like, or you can do a little experiment at home. You can do jumping jacks for like a minute, and they take your heart rate and compare it to your heart rate that you take when you first wake up in the morning or after you've been sitting down for a long time. So feel free to email me the results of your heart rates after doing some different activities. So we're moving on to the next slide. And we're going to talk about a healthy heart. And so if you look at this picture that I have here, a healthy heart, it has arteries and veins on top of it. The arteries are those red little lines on top, and they're called coronary arteries. And anything that applies to the heart we refer to as coronary. So that's why we call them coronary arteries. And these coronary arteries supply the heart with blood, and that blood has oxygen and nutrients inside of it. And that keeps your heart tissues very healthy and makes your heart able to pump very well the blood around the body. Okay, so that's a healthy looking heart with very healthy looking coronary arteries. But sometimes what happens in people is they have a heart attack. Okay, and a heart attack occurs usually because those coronary arteries that are supplying the blood to your heart muscles get blocked, and the blood cannot move through them as they should. And a heart attack happens when blood cannot move through these coronary arteries. And when the blood can't move through them, the oxygen cannot get to the heart, and the heart tissue starts to die. So you can see over there in the picture, the dying heart tissue actually starts to turn a darker color because the tissue doesn't have enough oxygen. And So, biomedical engineers can fix the heart with biomaterials. So you ask, I bet, what the heck is a biomaterial? Well, guess what? I'm going to tell you, and so is Graham. So, you may have heard of medical devices, and medical devices are made of biomaterials which help the body heal itself. And so you may have heard the term medical device before. What are some things that you think of when you hear the word medical device? Or what do you think a medical device is? Can you give me some examples? Or do you know of any, Graham?
Stethoscope and a tongue depressor.
Yeah. If any of you have gone to the doctor and the doctor listens to your heart rate, they put what's called a stethoscope on top of your chest in order to listen to your heart. And some other medical devices you may have heard of, a pacemaker, which helps your heart beat at the rhythm it should. Or so they can be very, very complicated, or they can be very simple. So I bet you some of you have gone to the doctor and your doctor has told you to open up and say ah, and as you do that they place a wooden stick on your tongue, and that wooden stick is called a tongue depressor. All it is a little wooden stick, but it helps the doctor to see the back of your throat better. So even though it's a very simple thing, it still is a type of medical device. So these medical devices are made of special materials called biomaterials. So how do we keep our hearts healthy to begin with, to avoid having our coronary arteries become blocked?
Healthy and eat less junk food.
That's absolutely right. So we should all eat a lot of healthy foods, and I know junk food is really, really good, and like it's okay to eat a little bit of junk food, but just eat less of them, okay? Keep it in balance. So that's a good way to keep those coronary arteries open and flowing so that your blood gets the proper amount of oxygen and nutrients it needs. What else can we do? Any ideas? Get enough exercise, right? And so what are some things we can do to get exercise? I don't know. It doesn't have to be very complicated. We could just go for a walk, okay? But if you like to make it a bit tougher, just run, walk faster, play some football, do some push-ups. Just, it's important to do something you enjoy so that you stick with it. Well, I hope you enjoyed our talk about the heart. And if you want to finish there, feel free to email me any questions about being a scientist or any other questions you have about the talk that we just gave about the heart. And if you want to continue on with the video, I'll teach you how to do a little activity at home. Now, I've shut off my camera because I want you to be able to see the slides fully in order to understand the steps of our activity. So I actually have two activities, but we use our same giant heart to do them. So activity one is a game I like to call Heart Twister, and it uses the same sort of concept as the game Twister, which you might have played at home. So the first step to creating our Heart Twister game is to draw a huge heart, because this is going to be your twister board. So in order to draw the heart big enough, I recommend that you get a sheet or even the back of a twister mat that you have at your house. That will provide a large enough area to create your giant heart on. So then you take that giant sheet or mat and you start drawing your heart. Now I recommend that the heart that you draw be at least 120 centimeters wide. And I suggest you also draw it with a pencil very lightly. That way if you mess up, you can go back and erase your mistakes and redo it. And so you have your heart. It's about 120 centimeters wide and at least 120 centimeters tall. Now you can make this heart bigger if you like. You just have to remember to keep it as big as possible because this is going to be your twister board for your game. Now, step 2, you're going to divide this heart into 4 sections. Okay, so take a ruler if you have one around, and this will help you draw your sections. And over on the right hand side of your heart, you're going to use blue lines to draw your sections. And this is to show you that the blood on the right side of your heart does not have any oxygen inside of it. And then if you go over to the left side of your heart, when you draw those lines, I would like you to use red, and this will remind you that the blood on this side of the heart does have oxygen in it. Now this might be confusing. You're probably looking at this and saying, well, do you have those labeled wrong? Because that says it's supposed to be the left side of the heart, but it's actually on my right side. Well, I wondered this myself. And it's because anytime you're viewing a diagram of the heart, you have to pretend that there's a person in front of you and you're actually looking at their heart. So if you have a person in front of you, notice that their left hand is actually on your right hand side. And it's the same for their right hand. Their right hand is actually on your left hand side. So it's the same when you're viewing a heart. Okay, so that's why anytime you see a diagram of the heart, the right side of the heart will always be on your left side, and the left side of the heart will always be on your right side. So you've divided your heart into 4 sections, and this is because your heart actually does have 4 sections. And these 4 sections are called the right atrium, left atrium, right ventricle, and left ventricle. Now, the atria of your heart are always on the top, but the ventricles of the heart are always on the bottom. And an easy way to remember this is if you look at the bottom of your heart, it looks like the letter V. Okay, and ventricles begin with the letter V. So that's an easy way to remember. The ventricles are at the V at the bottom of the heart. Okay, so you label these 4 chambers with different colors. And this is very important because this will help you play your twister game. So you label your right atrium using blue, your left atrium using green, your right ventricle with the yellow, and your left ventricle with the red. Now that you have your heart, you're going to play your game. And if you don't have a twister spinner at home, you can find one online. And I've given the website address for a website that has a twister spinner on it. Okay, so you just use this spinner and it'll spin the dial, and it'll tell you, okay, you need to put your right hand on green. Okay, so then you know your left atrium is written in green, so you'd put your right hand on the left atrium portion of your giant heart. Okay, and then you just continue spinning and put your hand or your foot on the color that corresponds to the section of the heart that your spinner tells you to. Okay, so that is the first part of our activities. And once you're done playing your twister game, if you want to, there's a second part. So the second activity using our giant heart is we're going to fix a heart attack using biomaterials. So here's your chance to be a biomedical engineer. So step 1 of this activity is you're going to draw damage to your left ventricle. Okay, so you just get a big black marker and you make a big blob on your left ventricle. And this signifies where there's been a lack of oxygen that has reached the muscle of your heart and your heart tissue has started to die. And this is what's caused your heart attack. Okay, and I've drawn it in the left ventricle because if the heart attack happens in this section of the heart, it's a very dangerous type of heart attack because the left ventricle is what pushes the blood from the heart to the rest of the body and makes sure the body gets all that oxygenated blood. So once you've drawn your heart attack on your left ventricle, you're going to be a biomedical engineer and use biomaterials to fix that damaged tissue. Now get creative here, and you can use any materials you have lying around the house, and I've given you some examples in the right hand corner. So you can just find some surgical gauze if you have a first aid kit lying around, even some cling film. Maybe add some medicine in there by having some glitter glue, and think of any you want to. There's no wrong answer to this. Just think about what the heart does, how the heart feels like, and what type of material you think would be suitable to fix a heart attack. And then you just place those materials on top of the damage to that left ventricle that you drew. When you're choosing the biomaterials to fix your heart attack, there's some things to think about. So the first thing is you want your material to feel the same as a heart feels. So the heart is a bit squishy, it's a bit soft, so you want to choose a material that's going to be a bit squishy and soft as well. So you wouldn't pick something that's really, really hard. You'd pick something that's soft and squishy. The property of the biomaterial that you choose should match the property of where it's going to go into the body. The second thing to consider is you'd want to choose a material that stretches with the beats of the heart. The heart is continuously moving to pump blood through your body. So you want a material that is going to stretch with the beats of the heart. And the third thing to consider is in real life, surgeons, when they're placing material on the heart, it has to be easy for the surgeon to use. And so just think of a material that is easy to work with. And so when we're doing this activity, the two most important things to consider are the ones I mentioned first. Try to choose a material that feels the same as the heart, and also try to choose a material that stretches with the beat of the heart. Well, that includes my video, and I want to say thank you so much for listening to us describe what the heart is and how it works, and also, if you chose to, for participating in our heart twister activity and our healing the heart attack activity. And we'd love to see some pictures of the hearts that you've created and any sort of biomaterials you may have used to fix your heart attacks. So please feel free to send us any photos or questions to the email address that I've given there. And I look forward to hearing from you. If there's any other things I can do for you, please feel free to contact me. Thank you so much. Bye.